Hey, this is Tracy from Aspen. Right now, I'm making a video and we are talking about GERD. GERD is also known as gastroesophageal reflux disease. It affects the upper digestive system, which includes the mouth, the esophagus, where the food goes down, the esophageal sphincter, which is between the esophagus and the stomach, as well as the stomach, of course. So, one of the biggest things about GERD is that it is basically a chronic condition. It is acid reflux, but acid reflux is something that everybody may get at least once or twice, maybe even more than that in their life, especially as we get older. However, with GERD, gastroesophageal reflux disease, which I will continue just to call GERD from now on, the problem is that people will have issues with gastric esophageal reflux. So the acid reflux may be moderate and occur up to twice a week, or can occur more often than that, or it can be really severe and may occur at least once a week. And these people are oftentimes needed to have some type of treatment, whether it be over the counter or to see a physician to get it checked out. So some ways of diagnosing gastroesophageal reflux disease, or GERD, like I said, I was going to start calling it, um, are using some tests. One is an upper endoscopy, which is when a scope goes down the mouth and down the esophagus, and the physician that's doing this procedure can see the stomach and the esophagus and the esophageal sphincter and be able to view and examine and assess what's going on and even take samples to do some type of testing outside the body. Another one is ambulatory acid probe test, which is when the physician places a monitor inside the esophagus and records when and for how long stomach acids regurgitate there. So they're put it in, and every time you have this acid reflux, they're recording and saying how long is this occurring, what time of day is this occurring, maybe. An esophageal manometry test is another test that measures the muscle contractions in the esophagus when swallowing, as well as the coordination and force used. And lastly, an X-ray imagery of the upper digestive system is used to see if there is a narrowing of the esophagus, because that can also affect what's going on and cause some GERD. Some common signs of symptoms of GERD are chest pain or burning sensation, difficulty swallowing, regurgitation of foods or sour liquid. I'm sorry, and I'm having some issues myself right now. And a feeling of having a lump in the throat. For people who mostly have problems with GERD at nighttime, they will also, including with these other symptoms, they will also have like a chronic cough, laryngitis, and that's the inflammation or the swelling and irritation of the larynx, and new or worsening asthma and problems with sleeping. Some appropriate treatment plans for medications that are given to people who have GERD are Pepsid. Some of these words are a little difficult. Nizatidine and ranitidine, which are all H2 receptor blockers. Nexium, prevacide, and omeprazole, pantaprozole, rabeprazole, and dexlansoprozole. I really messed that up, but I will definitely put it in the link, all of these medications with their appropriate spelling, because clearly I can't watch it. But all of those medications are all proton pump inhibitors, and we'll actually talk a little bit more of what proton pump inhibitors do. And another medication that's given, that's a prescribed medication, is Baclofen, which is used to strengthen the lower esophageal sphincter. Some over-the-counter medications that are often used, that can be used by patients, are Tums and Rolaids, which are used to neutralize the stomach acids. Some meds that are used to reduce the acid production in the stomach are over-the-counter Pepsid, which these are when we're talking about our proton pump inhibitors, Pepsid, Axid, and Tegarmet, HB. Some over-the-counter medications that can be taken to block acid production and heal the esophagus are omeprazole and lansoprazole. And actually, that's what I meant by those are the proton pump inhibitors. So the omeprazole, lansoprazole, and I believe Pepsid is part of that list as well. Some surgical interventions are, I found two, and that's the fundoplication and Link's device. So the fundoplication is really interesting. It's a laparoscopic procedure where the surgeon wraps the stomach around the lower esophageal sphincter to tighten up the muscles and prevent reflux. It sounds really painful, but I mean, clearly this is a procedure that's done when a patient is under anesthesia, so it's not something that they feel, and it's actually it's not as very invasive as it sounds. Another procedure is the placement of a Link's device. So the Link's device is a tiny ring of magnetic beads that wrap around the junction of the stomach and the esophagus, and that's basically where the esophageal sphincter is. And when those beads are wrapped around, they're magnetic, so they close it tight. And so when the fluid, which is the acid, is reflexing and is trying to push its way up, it can't make its way up. So it prevents the acid reflex. And of course, the first thing you'll think of is, well, how is that even possible to get food down? Even though it's tight enough to prevent the reflex from coming up, it's not, so it's weak enough to allow food to enter in. Okay, so that's the upside about that procedure. And I feel like those are just really given when people are absolutely in need of it. So as a nurse, our first job is to assess the patient and find out some ways to provide them with comfort. Oftentimes patients are given GI cocktails in the ER, which is a combination of antacid, lidocaine, and anticholinergics. This cocktail can only be given with an order. While waiting for those orders, the nurse can encourage the patient to sit straight up rather than lay down, as well as to assess the patient's heart using a telemonitor. And that's really important to ensure that the patient's not actually mistaking the feeling of acid reflux. They're not actually mistaking the feeling of a heart attack for acid reflux. And that's actually very common, and it happens mostly with women, surprisingly. Patients diagnosed with acid reflux should definitely be educated on ways to manage it. One way is through diet. Patients should be taught to avoid some foods such as coffee, as well as other caffeinated beverages, citric and acidic foods and fruits, such as oranges, grapefruit, pineapples, which are really high in acid content, tomatoes and tomato sauce, which is also highly acidic, carbonated drinks, chocolate. I know it hurt my heart too when I heard chocolate, but chocolate actually thins out the sphincter, the lower esophageal sphincter. It thins it out, which makes it easier for the reflex to occur. Peppermint, garlic, onions, fatty, spicy, or even fried foods. I know it's all of the stuff that we love, but unfortunately, it's not what's best for us. So if you or someone you know is having issues with GERD, you can definitely refer them to this video, have them see a doctor, see what their best options are. Okay? Thank you.